back to the channel. This video is going to be talking about the public health care and private health care in Ecuador. I want to thank everyone for their well wishes. I had surgery a few days ago. I'm not going to go into the specifics of my surgery, but I just want to talk about the difference in the IESS public health care and the private health care, and some differences that of the health care you receive in Ecuador versus the US. IESS public health care, a lot of your doctor's appointments, exam, lab works, any type of EKGs, echograms, sonograms, ultrasounds are covered under the IESS. So last year I knew that I had some issues that I had to be seen by a doctor. So we decided to get the public health care, the public health care through IESS. Through that, I saw several doctors because you have to see either a family doctor or a general doctor to discuss whatever issues you have in order to know if you may need surgery or if the symptoms can be resolved with just medication. Going through the public system, I went through all of the necessary steps of seeing a general doctor, and that general doctor then has to write a prescription, just like in the US if you have HMO, to send you to a specialist to see someone above that's specific to the issue that you have, a specialist. And so I went to see a cardiologist, I think, and I had to have lab work and all these things taken as well. With the public health care, your appointments can be sometimes within a few days. They can also be scheduled out 2 weeks. If that specialist doesn't have any availability within a few weeks, it can be months out before you can see a specialist, but it is covered. I know in the US, you have a copay, and sometimes when you see these specialists, your insurance may cover only a portion of your visit, and you still have out-of-pocket costs. So going through the public system, I went through all the necessary steps of getting the lab work done, seeing specialists before I could see a general surgeon. Well, by the time I was able to get to see a general surgeon, my situation was getting worse, and the public health system had not approved my the doctor's request for me to see a general surgeon. And you have only about 3 months to do all the necessary lab works and things of that nature to see a general surgeon. Now, if you get outside of that window, you have to start all over. Before I can actually see a surgeon, my symptoms was getting worse each day. It was to the point where I could not sleep. I was uncomfortable. Everything that I ate, I just felt bad. And so we decided to see a private doctor where you have to pay out of pocket. Now, in the midst of all of this, I've had translators, I've had friends to assist me with seeing these doctors because, as you all know, I'm not fluent in Spanish. Once we got a chance to go see a private doctor, I took all of my paperwork, all of my labs to the doctor. He looked over everything, and he was very informative about what was to happen next. And he was like, you can have this surgery done basically the next day, or you can wait till next week. And because of my situation, I didn't want it to get any more worse than what it was. I opted to go ahead and have the surgery done the next day. And that was actually a few days ago. Now, being from the US, the hospital stay is totally different in Ecuador. When I had gone to the emergency room in Ancon, I saw people coming in with pillows, different things. I thought it was for the family member staying with the patient. But my experience, when you go to have surgery, you need to see the pharmacy to purchase your sheets, sheets, and any other required supplies you need for surgery. I didn't find that out until the day of. Nothing to worry about. They did, give me some of the supplies. My surgery was scheduled for 8:30 to 9. I was going back at 8 o'clock. And when I was wheeled back to the surgery, the operating room, there was a bilingual anesthesiologist who taught me through everything. They were very patient with me. I would say 10 minutes I underwent the anesthesia, surgery began, and I was out, I think, within 45 minutes. I was wheeled into the room, and in the room, you do not have all the so-called amenities you have in the US. And what I mean by you don't have a pillow. There are no towels. All of these things you need to bring with you. Now, was it something that made my stay worse? No. I was there to get care, and I did get exceptional care. The nurses was very polite, very attentive to my care. They answered the call. Now, I will say, in the hospital room, I did not see a nurse button where you call the nurse. You definitely need to have someone stay with you. Because of that, I don't know any other way you would be able to contact the nurse if you didn't have someone with you, but they did say that you had to have someone stay with you overnight. Anything that I needed for his pain, nausea, there was no question. They brought it, they gave it to me. They did do it within a time frame. Like if I had it, I can't have it for the next 4 or 5 hours. They gave it to me the next 4 or 5 hours. I have a very low tolerance for pain. I have a lot of intolerance to medications and foods. So trying to get medication for pain and nausea, it only made the situation worse. But they were very attentive to stop the medication. They was like, okay, if this is what you want, they by all means will stop giving me the medication. And once they stopped the medication, I started to feel better. And the doctors were very, very attentive. They checked on me. I had two or three surgeons check on me. I had several nurses that came in. They had the cleaning staff came in and cleaned the room every day. It was a little bit much with the cleaning supplies, but I preferred it to be clean and just get over the smell that didn't last for about 15 minutes. But I just want you to know that although Ecuador does not have all of the amenities or the same level of items you find in the U.S. hospital, where your partner has a recliner he can lay down in and sleep, or they bring in a bed, there's just a chair. And it's basically for care. If you need anything else, you need to bring those things with you. not many people will be able to visit you because they want you in and out. You still have to wear a mask while you're in the hospital, which is fine to keep people from getting sick. But I am doing fine. Hopefully I'll be up moving around after I get my stitches out and getting back to my original routine. But I want to say thank you to all of those who have sent their well wishes to me. I'm doing great. And again, thank you for watching. Like, share, and subscribe. Talk to you later. Bye.